Hello, do you guys know depression? Depression is the leading cause of disability worldwide, affecting millions. In the United States alone, nearly 10% of adults struggle with it. Yet, because it's a mental illness, it can be harder to grasp than physical conditions like high cholesterol. A common source of confusion lies in the difference between feeling depressed and having clinical depression. Most people feel sad or down from time to time. A bad grade, losing a job, an argument, or even a gloomy day can bring on temporary feelings of sadness. Sometimes these emotions comes without any clear reason, but as circumstances change these feelings typically fade. Clinical depression, however, is a different. It's a medical disorder that doesn't simply go away with time or willpower. It persists for at least 2 weeks, significantly disrupt daily life, impacting work, relationships, and overall enjoyment of life. The symptoms of depressions are includes persistence of low mood, loss of interest in activities once enjoyed, excessive guilt or feelings of worthlessness, trouble sleeping or oversleeping, difficulty concentrating or making decisions, fatigue or lack of energy, restlessness or feeling slowed down, thoughts of death, and suicide. If someone experiences at least five of these symptoms, they may need the criteria for clinical depression. But depression isn't just about feelings or behavior, it also affects the brain physically. Really happened in the brain? Depression involves visible and invisible changes in the brain. For instance, shrinkage of the frontal lobes and in hippocampus. While researchers don't yet fully understand what causes depression, it's believed to result from a complex interplay of genetic, biological, and environmental factors. Unfortunately, no diagnostic tool can yet predict its onset, and because the symptoms are often invisible, people may suffer silently for years. On average, someone with depression waits over a decade to seek help. This delay can stem from stigma, guilt, or misunderstanding. But the good news is that depression is treatable. The effective treatment includes medication, therapy, electroconvulsive, emerging options like stimulation and other innovations are showing promises. How to help? If you know someone struggling with depression, encourage them to seek help gently. Offer practical support like researching therapies or helping them prepare questions for a doctor. Taking those first steps can feel overwhelming to someone with depression. Remind them that depression is a medical condition, not a weakness or personality flaw. They wouldn't blame themselves for asthma or a broken arm, and they shouldn't expect themselves to simply snap out of depression. If you've never experienced depression, avoid comparing it to temporary sadness. It minimizes their struggle and can add to their guilt. Instead, foster open conversations. Asking about suicidal thoughts doesn't increase risk. In fact, it can reduce it by showing that you care. By talking openly about mental health, we can break down stigma and create a culture where seeking help feels safe and supported. The more people seek treatment, the more scientists can learn about depression, and the better the talk, the treatment will become. So, let's listen and support for each other together. We can make a difference.